So yesterday, the American Cancer Society sent out some new guidelines that bump up the recommended age for getting a mammogram to age 45 from age 40. A lot of young breast cancer survivors were outraged with this one. I kind of raised my eyebrows a little bit, but I'm in a different category. My mom is a survivor of, we're going on 11 years now. So as soon as she was diagnosed, I started getting mammograms at that time. So I was, 34 when I started getting mine. So it's kind of been interesting. And the debate is definitely out there. We are joined now by Dr. Monique Fox, who is a fellowship-trained breast imaging radiologist with Diversified Radiology. Dr. Fox, thanks so much for joining me.
Hi, Susie. Thanks for having me.
Absolutely. So when this news came out, and I know that you are so directly involved with this with your line of work, what was your thought that they raised the recommendation up by 5 years?
You know, I'm once again baffled by these recommendations. We know that screening mammograms save lives, bottom line. And once again, mammography comes under fire, especially during Breast Cancer Awareness Month.
Yeah, that seemed kind of an odd timing, right?
It is. It's disheartening.
Yeah. So what's the reasoning behind it? Why they would do that? Is it an insurance thing? They don't want people starting till age 45? Is it costing too much money to get, people covered for these mammograms?
You know, I'm really unsure as to what's behind it.
Okay.
We know mammograms save lives, and we know that we are saving lives beginning at age 40, not 45. I don't know why they keep being wishy-washy on their recommendations.
Yeah, it's kind of baffling, and of course there's I don't have the whole guidelines in front of me, but I'm guessing that if there is some history involved, did those guidelines change as well? Or
they're using data that it's 20 years old, and they reanalyze this data over and over again, and they come up with these different recommendations. The USPSTF came up with them, starting at age 50. They've kind of cut it down to the middle at 45. But they don't take into account all the women between 40 and 45 that are diagnosed. I mean, in my line of business, I see a fair amount of women that are diagnosed between age 40 and 45. And while it might not be statistically significant, it's significant to each woman that is diagnosed, and potentially we can save her life at that time.
Absolutely. Both groups, the American Cancer Society and the U.S. Preventative Service Task Force, are recommending women ages 55 and up to skip annual screenings and get them every 2 years. What are your thoughts on that, Dr. Fox?
Well, what they're using is the age of menopause. So at the age of menopause, when you're diagnosed with breast cancer, the rate of the nice breast cancers, so to say, the cancers that are estrogen and progesterone responsive and slower growing increases. So they say that because these cancers are more likely to occur in these women, they should skip a year in mammography and have their mammograms every other year because the cancers are going to grow slower. But unfortunately, we don't know which cancers are which, and we don't know who's going to get what. These women still get aggressive cancers. So they're actually playing the lottery when they do biannual screening, because you can miss as many as 40% of incident cancers if you switch to 2 years versus 1.
40%? Mm-hmm. Wow. Okay. And then also, I mean, and there's a huge push. Of course, you're supposed to do your annual or your monthly, self breast exam. But even those can't catch what a mammogram can, correct?
When you do a monthly self-breast exam and you feel a lump, the lump has to be about 2.5 centimeters for you to be able to feel it.
Okay.
What we're trying to catch on the mammogram is that 1 centimeter cancer before it's palpable, because the changes in treatment are so much better and your outcome is so much more favorable when you catch it smaller between, that 1 centimeter and that 2.5 centimeter time. That's when we're trying to find the cancers on your mammogram.
And that's where it doesn't make sense to have somebody skip, especially after the age of 55, because even if you're doing your monthly exam, you may not feel it. And if you've skipped a year, you're not going to see it till maybe a little bit too late and too big.
Exactly.
Oh, wow. Okay. So, I mean, is there anything, I don't know, what and there's been a lot of outcry. I know people like you are not very happy about it. It like I said, it raised my eyebrows because I thought, wait, wow.
I know.
I would have only started this year had my mom not had breast cancer. I would have started this year, and that seems a little late to me.
Well, I wanted to say, too, that this analogy or this analysis that they they put out did not even take into account all the new technology that we have now. We have 3D mammography now. So when they talk about anxiety and the callbacks and things like that, the 3D technology has decreased that significantly. We don't call people back as much, and we don't have as many false positives as we used to. So to say that with this recommendation is, again, using data that's 20 years old. And luckily, we've progressed so much from that time. The data, it was gathered for this study that our recall rates have decreased 15 to 20%, and our cancer rates have increased 40%.
Oh, wow. And
so this wasn't analyzed at all in this article.
We're talking to Dr. Monique Fox, who is a fellowship-trained breast imaging radiologist with Diversified Radiology. Tell me about this 3D imaging, because that sounds very interesting. Is it similar to what they're doing with babies and ultrasounds?
No, we're actually using a mammogram, but instead of taking two pictures of the breast, we can now look through the breast with slices. So my analogy is looking at a book with the covers closed versus now being able to leaf through the book with the pages open. We can see so much more of what's going on in the breast than we used to.
Wow, that's great. That's really good. Okay, all right. Well, Dr. Fox, thank you for your thoughts on this. I'm with you, and we'll see if maybe they if they come back on this and lower that age a little bit again, because I just don't understand the 45.
I know. I hope so, too.
Yeah. All right. Thanks so much, Dr. Fox. Appreciate that. That's Dr. Monique Fox, fellowship-trained breast imaging radiologist with Diversified Radiology, speaking out about the American Cancer Society guidelines bumping up the recommended age for getting a mammogram to age 45 from age 40. And a lot of young breast cancer survivors who we hear stories about all the time are not very happy about that. So, and it's one of those things, just, I guess, be smart. And if you think you should go in, it doesn't hurt. It's fine. I went last week and it took literally all of 15 minutes. I was in and out and done, and hopefully I'll get my card that I'm all clear very soon. I always like to see that one, but it doesn't take very much at all. And it's a good thing to go get done.